Hi, it's Patrick Hutzel from intensivcarehotline.com with another quick tip for families in intensive care. Yesterday I had Carol send me an email with a question, and she said that her mother was in intensive care now for 6 weeks. Initially she had bypass surgery or open heart surgery. She had some complications. She ended up ventilated for 2 weeks, ended up with a tracheostomy, and then eventually was weaned off the ventilator, even got decannulated, basically had the tracheostomy removed, and 10 days later, just as she was on the cusp of going back to a ward, she ended up with pulmonary edema and she had the breathing tube reinserted again, and she's now in ICU, still in an induced coma, back again with the breathing tube. So now Carol is asking whether it's worth continuing treatment because she thinks her mum is suffering, and whether it would be better to let her pass away. Now, my advice in a situation like this is, Carol, for now it's probably too early to make a decision. You got to see how it goes in the next few days. What you need to keep in mind is, even though it's a prolonged ICU stay, and it certainly comes with, undesired side effects, you still have to remember most patients in intensive care survive their stay. More than 90% of patients in intensive care survive their stay. That's number one. Number two, when patients are in a prolonged induced coma, they don't remember anything. Even though you think it's not pleasant, and it probably isn't, your mum probably won't remember much of it. The other thing is that even if the intensive care team was to withdraw treatment, there's no guarantee that your mum was actually dying, without the help of medications that could potentially euthanize your mum. You got to consider all of these things. So my tip for today is, if your family member is in a similar situation, you got to keep going for now and see how it unfolds. You got to give your mum more time in a situation like this to see whether she can come off the ventilator, and then make a decision from there. That's my tip for today. Take care, and I'll talk to you in a few days.